are listening to Starter Girls Podcast with Jennifer Loading. Whether you are starting a project, starting a business, starting a brand, or starting a movement, we are here to talk about it. And so I'm super excited to welcome Dr. Amber Brown to the show. Welcome, Amber. Excited to have you here.
I'm excited.
Yeah, so I'm going to tell our listeners a little bit about you, and then we'll jump into this and get going. I got a lot I want to talk to you about today, so we're going to have a lot of fun. So,
Okay.
Dr. Amber Brown, PT, DPT. She is the founder and owner of Root Physical Therapy and Wellness, a safe space to learn about the root causes of your concerns. As a doctor of physical therapy, she focuses on orthopedic conditions, oncology rehab, lymphedema, chronic pain management, women's health, prenatal and postpartum care, bowel and bladder dysfunction, pelvic floor dysfunction. And she's just got a lot of things that she does. And she's laughing back there like she's like Superwoman here. I love it. She is also a certified I can't say that word. Say that word for me, Amber. I'm like, all of a sudden, blah, blah, blah. Yeah, therapy and registered yoga teacher. She stresses the importance of the community knowing that we are our best advocates and we need to speak out. She teaches her clients how to do just that and guides them to appropriate resources as a health coach. Let's see what else she does. She put here that these are a couple things that she talks about. She says you do not have to make your journey on your own. You thrive in a tribe. She's also a certified financial coach. And remember, wellness is cheaper managed than treating an illness. And we talked about this, right? Not slapping Band-Aids on people. She also has a podcast, Care For You First, providing health and wealth tips. The goal in mind is to educate the community so we can have a better quality of life. We need to learn how to put ourselves first again and leave a lasting legacy. So welcome to the show, Amber. I'm so excited to have you here. So many great things about you. And I know when we met, oh my goodness, we just talked for a long time. And I'm like, you and I have a lot of common threads. I mean, different things that we're doing, but we share the ideas about wellness and taking accountability for our health. And I think right now that is so important with what we're seeing, because I think so many times that people do not understand that, yes, we are the best advocates for our own health. We are the ones that need to know what we need to do. So what I want to do, I want to jump right into this. I want you to tell me a little bit about tell our listeners how all this came about for you. Like, tell us some stuff about this.
Well, really, it's all tied in. So I knew I wanted to get in the medical field way back when. And through physical therapy, you have to actually go through like observation hours to apply and to see if that's really what you want to do. So that's what started me in this journey. And when I was a tech, there's always this one physical therapist who had moms coming in, and when we had to clean up at the end of the day, everyone would there's condoms in the trash. You're like, why are there condoms in the trash can for physical therapy? What's going on? I later found out there was a treatment technique that was required for some of those patients for pelvic floor dysfunction. So I was like, what? PTs do this? So that was my introduction.
Wow. Well, that's quite an introduction, right?
Yeah. You're just like, wait, this doesn't make sense. But no, it's just experience. I made sure I had great mentors along the way to kind of see, was this what I wanted to do? Because, it's a new route for me. And my passion is just there. You are constantly educating everyone. Along the way, I realized connecting yoga. A lot of us don't know how to slow down and be still. So,
right.
When we have chronic pain and we just don't know how to manage certain things, yoga, kind of how that tied into there. And then as far as the finance coach, I realized a lot of people don't manage their finances to take into consideration healthcare. Whether that's including your insurance, and we can go on a whole nother thing about health insurance, knowing the difference between premiums and deductibles and copays, and so that's kind of also how the financial coach came about, because I've always been great with finances, and I was already educating a lot of friends and family. So I'm like, let me educate patients too.
No, I love that, and the show that I did right before yours, I was talking about how people make changes when they're pinned against the wall. And what are the two things you can't live without? Health and your money, right? Your health and your money. And so I love that you're tying the two together And really, I know when we connected, the whole thing was we were talking about the wellness side of that because you do orthopedic stuff. And so a lot of times, when we're talking about doctor stuff, a lot of times there's this whole idea that we're just trying to fix a problem rather than, and it's an immediate fix. It's what can we do right now to get you in the, out the door and back on your feet rather than what can we do to prevent this from happening again.
Right.
Right.
I joke and say, I know I'm doing a great job as a physical therapist when you don't have to come back for the same thing. Not that I don't love my patients, they are great and amazing, but whenever you don't have to return, that means I know you now know what to do to help heal yourself.
Right.
So that's my job.
I love that. And I think that you're doing the financial side of it too, because I always talk about these 4 quadrants when I'm coaching, and they're split up, and you've got, your health and well-being in a quadrant, you've got your vocation in a quadrant, your relationships in a quadrant, and you got your time, money, freedom. And a lot of times when people, you might have one area that you're lagging in and you may have success in some of the areas, but oftentimes, a reflection of people's health and all of this kind of goes together. And when they're struggling in one area, they're probably struggling in multiple areas. And so I love that you're taking that approach of taking the financial side and the health and well-being side and kind of tying those together, because those are 2 very important major areas.
They are. And they connect with each other, right? So some people will start stressing about money.
Right.
And then the long-term chronic effect of stress is not good on the body.
Right.
Or some people have a lot of money because they worked all these hours. They didn't have great, work-life balance.
Right.
And by the time they're ready to retire, which, by the way, is a financial number, it's not an age, right?
So
you're different ages.
Right.
But some people can't physically enjoy retirement. Mm-hmm. Because they didn't manage their health throughout all those years. So there's connection.
I agree 100%.
Such a strong connection.
100%. So let me ask you a fun question. This wasn't in the questions I sent you. When you were a child, did you just have this, I heard you say earlier, you knew you wanted to go into the medical field. You kind of had that plan. But did you think that you would be doing this? And did you think you'd be an entrepreneur, like you'd be doing your own thing?
No, family thought I would do something with finances just because I've always been like a money nerd. But no, I remember one time thinking I was going to be an ophthalmologist. And then when I was shadowing someone, they're like, do you want to look at eyes all day? I'm like, I don't think so.
Right.
And then, of course, I was just, it was just life kind of brought me to this when I started realizing, I've had physical therapy for my ankle. I had physical therapy, my mom had it for her back. Someone had it because they had an amputation. And that's just kind of what led me to physical therapy.
Yeah.
And I remember in my early years of my career, my patients would ask me, are you going to do your own practice? I'm like, no. I'm comfortable. I'm salaried. Once I leave here, I don't have to think of anything else. I'm comfortable.
Yeah.
But then, burnout's real,
right.
Especially in corporate healthcare.
Yes. I agree.
And, you don't always get to have like the best quality of care.
Right.
Not saying don't go to corporate, but as a clinician, I just realized I hit my limit. So that's what led me to entrepreneurship, and I'm loving it.
I love it. And how long have you been in business now?
On my own completely for 2 years.
Wow. Congratulations.
Thank you.
I love it. So as a small business entrepreneur, you're doing your thing. What would you say was probably the most difficult thing getting you into that? Like, what was probably the struggle for you?
The confidence, right? You get comfortable with knowing I have a paycheck. Like if I stay where I was, I have a secured paycheck with benefits, just being comfortable.
Right.
But then having to weigh the balance, weigh it out. So whenever I was picking up my physical therapy practice, I wanted to make sure I was able to gradually build it. So I had that option because I was managing my finances. So I was like, okay, I have this much money on the side that I can support myself. So I didn't have that stressor about I have to see people. I have to see them.
Right.
Which helped me lay down the foundation and get my systems in place for my company to be smooth. Because I knew my ultimate goal was that I didn't want to have that burnout. I was already burned out before.
Sure.
So yeah, that was more of confidence. And then having figured out a good system.
Right. Well, and I love that. The thing that I really liked about you when I met you, and I will say this, is that you're very relational, and I think that that's huge when you're in business. I think being relational is huge in every aspect. Whatever you do when you work, unless you're working behind a computer and you never have to talk to another person again, being relational is important. And people think, they say that it's only, a lot of times people will say it's only certain jobs need to do this. No, I think being relational is always important. And I love that about you because when you were talking about not having to worry about those numbers and stuff, when people start having to worry about filling numbers, other people become transactions. You know what I mean? They're a number to fill in a void, or a gap. And I love that you're very transparent, but also very relational in that your sole purpose here is I want to help you. And I love that you said, earlier about, I know that I've done my job when you don't return back for the same condition. So you're thinking big picture here. How am I solving this problem for you so that you can walk away and be better, not have to come back for this again? I love that. I love it.
And another part of what made me finally break off, besides the burnout, was the fact that some of my patients couldn't afford that location.
Oh, okay.
Even with insurance. So I'm like, all these people need help, especially moms, but they can't afford it. Like they're stressed because of the bill. But I have control and I can, change things in my own place.
Absolutely. That means you can do what you want. Work the way you want to work. That's the great thing about being an entrepreneur, right? I like it. You can do your own thing. That's awesome. That's awesome. So we've kind of touched about all of this, but I want to ask it again because I think it's a fun question. What do you love most about what you get to do?
Empowering people.
I like that.
When you see the spark, when people are like, wow, my body can do this. I can do this. I like to be able to remind people of the small gains, because especially with physical therapy, typically it's not like you come in one day and then the next day you're like perfect.
Right. Right. No.
It didn't happen overnight. Whatever the injury was or the concern, it didn't happen overnight. But being able to remind people like, hey, remember when you first walked in, you could barely sit down or you could barely roll on your side.
Right.
Now look at you. They're like, oh, I didn't think of that. I'm like, yeah, that's why I take notes, and that's why I'm kind of coaching you along. And just being able to empower people and educate them about what their bodies are capable of it's great.
You have great energy too, and I love it. You're like, let's focus and celebrate the small wins here. You know what I mean? And it's good that you're taking those notes because you're right. A lot of times people, when they, it's everything about health. From what I know is people, they don't realize it's like when they have a crisis, they think it happens overnight. It didn't happen overnight. This has been kind of a continual pattern. And then finally your body catches up with you and says, hello, you've been abusing me for a while. And now I'm done. Right. So then they think on the flip side, they're like, okay, well, I had this crisis. Now I should be back to one piece very fast. And that doesn't happen either. And so I love that you're emphasizing that, hey, look, this is where you started. This is a progress you made, because I think it's like that in everything. And people, want instant gratification. A lot of times they don't recognize that, these things you have to work at these things. And so I think that's great. So,
and going back to that, some people would think, oh, well, exercise takes a lot of time.
Right.
Not exactly. No. Especially when I'm dealing with treating moms. You don't have 3 hours sometimes, especially with a newborn. So if you're with the right person, they're able to kind of say, what matters to you?
Right.
Okay, these are the top 3 things we can do. What time can you dedicate to this?
That's good.
Okay.
Yeah.
And these are the exercises we get to the time that you can dedicate. It might be 15 minutes a day. But that's 15 minutes more than what you did the day before. Right. And that's okay, right?
So, and you're so cute. You smile about it too. I love it. You're like, you're not going to tell me, no, we got this. We got this. I love it. It's like that whole thing you've learned about. You want to read a book and you're shaking your head like this up and down, right? It's subliminal messaging. No, I love it. You have great energy.
Also, I would say I match the energy of the person I'm with, right?
Yes.
So if my patient's in pain, I'm not going to be like,
absolutely, absolutely.
I match the energy.
Yes.
And part of my name is getting to the root of it. So you mentioned, it didn't happen overnight.
Right.
Most of the time we find out, oh, you mean that one time you twisted your ankle while playing volleyball?
Right.
Oh, yeah, that's why you have this chronic. Yeah,
exactly. No, that's good. And yes, and matching the energy 100%. I agree with you. You do. You don't want to be like Pollyanna if you got somebody in there that's at a level 10 pain scale, you know?
Right.
You want to keep it positive and you want to keep it moving in the right direction. But yeah, they're not going to be real happy with Pollyanna coming in the room.
Oh, yeah, you're in pain today.
Yeah, exactly. You know, there's nothing like that. You come in and you're like, you're in a 10. And I've been there because when my nerve pain was really bad and I'd go in there and they're like, on a scale of 1 to 10, where are you? I'm like, I'm at 99. Do you need me to say any more? Don't ask me. Oh, today's a good day. I'm at 7 today. You know, so that, yeah, you want to match, definitely match the energy. All right. So, who would you say is been your greatest influencers?
I would say honestly, my parents.
That's awesome. I think that's
my
great.
Parents. They were my foundation. They just, with all the work that they put in from like where they started to where they ended, I'm just like them.
Yeah, no, that's awesome. That's awesome. So some fun questions about you. So what do you like to do for fun when you're not empowering and helping other people?
Yeah, well, you know, before COVID, I traveled. So, of course, my travel was going to kick up this year was, of course, when everything happened. So I kept getting all these notifications about cancellations, but that's my happy time. Sleeping is also a fun thing for me.
You need sleep. I agree. You need that.
My bed and I are like best friends. So, you know,
do you have a really good mattress? You got to have I was going to say, you got to have a really good mattress.
I'm one of those people who can sleep anywhere, though. Honestly,
that's good.
Whenever I'm with my friends and we're like trying to figure out who sleeps where, I'm like, I don't care. Just give me a bed.
Did you need a sleeping bag?
I can sleep. Yeah.
Sleeping bag, a sleeping bag and a pillow. You're good.
That's all I need.
That's awesome.
I also just like listening to music, just relaxing and enjoying having. Oh, and Judge Judy.
Judge Judy. That's so funny. Hey, on the topic of music, yesterday I was reading an article from Stanford, and they were talking about how dancing can actually help reduce dementia. Isn't that funny? So I'm like, we all need to jump on TikTok and start doing some videos.
Right. Well, dancing and then just music alone, especially if you throw in the music for any kind of time period, especially when it relates to someone. Oh, and guess what? It's exercise.
Exactly.
Don't tell anyone that, but it's exercise.
It is. What kind of music do you like?
Variety. So my favorite really would be like what we call neo soul or R&B, like smooth.
Yeah.
Smooth jazz.
Okay.
That's really great too. And then of course my 90s pop.
90s pop. Did you say?
Backstreet Boy.
Oh, Backstreet Boy girl. Oh, yeah. I used to teach aerobics, and they used to be on my I'm going to date myself because when I first started teaching, we had cassettes.
I know about them.
And then
we used to have to record off the radio.
And then I got clever and I got CDs, and I actually had a DJ mix some music for me. Then I was using my class. I had like really cool music back then. You know, it was like one of those. She's got the cool music in the aerobics class thing. But Backstreet Boys was on there.
Yes,
some of my jams.
Talk about those CDs, and I see all my high school mixes now. You know, where you're just like, summer of whatever.
Right. That is too funny. Too funny. Do you have any good books that you're reading right now? Anything that you recommend?
I have a stack of books that I want to catch up on.
Gotcha. That's maybe good. Yeah. Be on your list
my list to be able to do that.
We have a lot of, with us being in this lockdown that we're in right now, it's so funny because all these things, like I was talking about my son the other day, he has to stay busy like all the time, like me. He just has to stay busy. So the good side of this is he has been almost, I want to say, renovating my house. He has power washed my sidewalk. He has painted my vents. He started painting the back room. I think today he was going to wash the car, and then we were like, no, don't wash the car. It's going to rain. Yeah. So we're getting, it's like it's funny because we have this time now to get things done that have been on our list. Like I have this where my office is in the back. I'm like convinced at some point I'm going to get motivated to just like clean that room out. It hasn't happened in the time that we've I've not been inspired yet, but I keep telling myself I'm going to get it done. It's on my list.
I mean, this is my time for a reset, right? Yeah. I've been telling everyone that, whether that means I need more sleep, because, that's my best friend, or organize my house, because you mentioned earlier just your environment. It just makes a big difference with like mental.
Right.
I'm like, okay, I want to be able to clean this or get this organized. all those things that have just been carried over from to-do lists, like per week, per month, like I'm prioritizing, but I'm also giving myself time to rest. So the books will be there.
Hey, and that's good. That's good. No, and you do need to get rest needs to be a priority. That needs to be in there. You can't be 100% if you're not for somebody else, if you're not 100% yourself. Exactly. Like, right? You can't pour from, what do they say, the empty cup or whatever. You got to have it all in there. So, all right. So fun questions. Are you a morning or a night person?
Night owl.
Do you get creative? Is that when you get like really okay, so have you ever read the book The Power of When by the Sleep Doctor? You're going to love this. It's by the Sleep Doctor.
I'm going to have to make sure I know this.
Get it. Okay, so he talks about that we're all these 4 animals, whether you're a lion, a bear, a dolphin, or a wolf. So lions are morning people, wolves are night people, and then the dolphins never sleep, and then what I say, bears. Bears are what most society norms are based around bears. They get up normal time, go to bed normal time. So I'm a lion, means typically I'm up early. I'm not as good at night. What's interesting about all of this is depending on that. So like for me, I'm task oriented in the morning. That's when lions get up. Breakfast is their favorite meal of the day. Like I can get up at 5 a.m. and have my entire day done by noon. And I'm like good to go for the rest of the day. But what's so interesting about that is that's not when I'm creative. I'm creative at night because I'm off being task oriented. So a lot of times if I'm wanting to, my really good ideas that come to me are done in the latter part of the day and in the evening. If I want to get things done, I need to do it mid-morning, early. So you might be the opposite. You might find at night you're probably really like great task oriented. And then earlier in the day is when you might be a little more spontaneous and creative.
I would definitely say just over the years, it's always good to know yourself.
Yeah.
Right? So over the years, I would definitely say I had to block out my schedule saying, okay, this is my time to say focus.
Yeah.
Because, if you have schoolwork or something, you don't want to wait till midnight. But I'm most focused at night. I was the type of student who it was better for me just to stay up and study than to try to trick myself to wake up early and study. Right. I'm not going to do it.
Right. Well, you'll enjoy that book. You're going to enjoy it then. Go ahead, I'm sorry.
No, you're fine. I mean, I'm going to definitely look that up because I work a lot with sleep hygiene. And I always tell patients, I'm not going to try to change who you are naturally.
Right.
Like if you try to make me a morning person.
Yeah. Forget it, right?
Yeah.
You're going to come out with like claws at us. I don't think that would really happen with you, but you might not be talking to us.
It's actually funny. I'm one of those people who I will constantly hit the snooze button.
Yeah.
Once I'm up, I'm up. Right. So I might have like a temper tantrum in bed, like, I don't want to get up.
Yeah, you're ready to go.
I don't need coffee.
That's awesome.
But
yeah, well, you will. That book is really good. You will like it because it tells you even things like it'll tell you when to close contracts, when's the best time for you to be actually negotiating, calling, when's the best time to take exercise, take your medicine. And it's all based on the circadian rhythms when you're sleeping. So you'll appreciate it.
Say the name one more time.
The Power of When. W-H-E-N, not W-I-N. So just if you look up Sleep Doctor, you'll find it. It's pretty easy to find it, yeah. But I thought you're going to appreciate that book. And it's good because it's kind of a scientific book, so there are parts of it that get kind of boring. But if you flip to the parts you need to get to, you'll get what you need out of it,
I love that.
So
I love learning. So
exactly. All right, so cat or dog person?
Dog.
Okay, do you have a dog?
I don't.
Okay.
I travel too much. So and work. Yeah.
That's true. Maybe someday, right? You'd be like me, you'll end up with a bunch of them.
Right.
All right. What's your favorite food?
Sweets, but like carb sweets.
Yeah.
So I need like a cookie, cobbler, cake, pie. Yeah.
That's your thing. You know what? You're in good company. Because I do low carb, but I'm not gonna lie, I do love sweets. And it's funny because I don't eat a lot of it because when I do, it gives me a headache. Like it really, I feel like I have a hangover the next day. I do not feel great.
Have you detox from it though? Is that probably why?
Yeah, because I don't eat it very often. Yeah, I mean, I did keto for 22 months, so I just, and then I had a little bit of a lapse there. And even when I say lapse, I've not eaten probably the way that I before keto. I haven't been back to that way ever since that time. And so, but I in December kind of went back down to really low carb again. So there are a lot of days that I probably eat pretty close to keto level. Mm-hmm. So if I'm going to splurge, if I'm absolutely going to splurge, I'm going to go get Andy's custard. That's going to be it. It's going to be ice cream. It's going to be something of that, or maybe a cobbler, whatever. I could care less about potato chips or French fries. If it's going to be a splurge, it's going to be one of those. like ice cream, or like cobbler and ice cream, like cherry pie and ice cream.
Why
Totally.
would you say this right now? Like my taste buds just started watering.
Yeah, right. We're like, want this. It's so funny. All right. So summer or winter person?
Winter.
I love it. I love it. You're a cold girl. You like getting your jacket and your boots on and all that fun stuff.
I used to live in Alaska.
Did you?
Yeah.
Really?
So I think it's probably part of that too.
Yeah. I'm a summer girl, but I don't mind putting my boots on every once in a while. I just don't want it to rain when it's cold.
I just don't travel during winter because I don't like all the layers.
Yeah, I understand.
Yeah.
So before I wrap this up, you have any great nuggets of wisdom you want to share with us? Anything you want to share about your practice or final thoughts?
Yeah, so I mean, my biggest thing is you are your best advocate. Like, you can fight for yourself and whatever that means. If you ever need guidance, there's always someone you can ask for help and assistance. You're never alone. Enjoy life. Like, live life and enjoy it and be happy and, just have a great tribe around you. It makes life more enjoyable. But I do have the 2 practices. I have my podcast, Carefree First.
Yes, talk about that real quick.
Coaching. Oh, yeah. And financial coaching. And then, of course, I have my physical therapy and yoga for more just wellness and getting you back to being able to move and be happy. So 2 separate functions, but they actually connect. And I'm loving life.
I love it. And where do they find you if they want to come get in touch with you? Where do they find the podcast? And then where do they find you for your practice if they want to get some more information?
Yes, for my practice, I'm located in Plano, but I have my website, www.root, that's ROOT, ptandwellness.org. I can be found on Instagram or Facebook, same thing, Root PT and Wellness. And then for my podcast, I have an Instagram page for it, Care the number 4, You First, or you can find me on Spotify or even Apple.
I love it. So when this show goes out, Amber, I will be sure to put all your contact information in there so that the listeners can locate you and come check you out. And I love that. I love that you're doing a podcast and you're sharing your information and knowledge with people. That's the best way to get it out there. And you're doing amazing things. I think you're just doing wonderful things. And like I said, the day I met you, I was like, we had a lot of, even though we're doing completely different things, I guess we are doing a podcast. Our message is really quite similar. The underlying message is quite similar. And I think that's really, it's just teaching people. I always talk about teaching people that in all areas of your life, you have choices. You are accountable for you. It is about taking responsibility for you. And there is always help. There is help to help you get that. It's not, it's not you against this crisis that you're in. It's you going through it, and you can come out on the other side. You just got to find the right people to get you where you need to be and take that accountability to get through it. So I love.
There's always someone.
I agree, 100%. And I love what you're doing, and keep being you and keep shining. You're doing great things, girl.
Thank you.
All right, so hang on here. I don't want you to leave, but what I'm going to tell our listeners really quick, if you love our show, please be sure you give us a rating both on iTunes and Facebook, because of course we cannot do this without you. And with that, I'm going to wrap up with our mantra. So it is a great day to be brave. You might as well start now. You have the power to change your circumstances any day you decide. Let today be that day. Rise up, be amazing, be you, do you. All right, you guys take care, be safe, and be kind to one another. We'll see you next time.